Amanda, can you talk a little bit about the structure of your PNT committee?
Yeah, so for our health system, there is a subcommittee for PNT, specifically for hematology oncology, and that's a system-wide committee. So it is chaired by myself and a physician, and there's representation from nursing, advanced practice providers, physicians, and pharmacists on here. Generally, when we go through the formulary process, a request is made, and a physician and pharmacist dyad put together a monograph and review the literature regarding the agent that's proposed to be added to formulary. We then review it at the system-wide hematology oncology PNT committee, and from there it moves on to the system overall formulary committee for final approval.
And how often does your subcommittee meet?
It meets once a month.
Okay, great. When you're bringing, so we have a new AML drug that comes on the market and you're bringing this to your PNT committee for formulary consideration, what are some important outcomes or efficacy endpoints that are critical for you to present to help support your decision making?
Yeah, so this is an interesting question, right? We always like to see a randomized controlled clinical trial that has hundreds, if not thousands of patients. And unfortunately in AML, that's not always feasible. So we have approved agents based on phase 2 trials, based on open label studies, based on smaller trials where we did feel like there was enough evidence to say that the benefit outweighed the risk. And I think more than anything, just because the need is so great in AML, that some of these agents have been able to come to market and have been added to formulary. So overall, the best thing that we'd like to see, obviously, is a difference in overall survival. But other efficacy endpoints that we look at are maybe a proportion of patients who are able to go to transplant, relapse-free survival,
and rates of remission.
Rates of remission.
I mean, even the FDA has taken that into account. They have approved medications for AML even before there's necessarily overall survival data or phase 3 data. Some of the newer medications that have been approved recently were approved based on phase 2 data by the FDA, including venetoclax combinations.